for which I would highlight the technology LED of Lightning, the big and wide touchscreen, which is very user-friendly, and the capacity of memory of the product that allows different users to save all their protocol. We have a full range of contra angles for implantology called Mont Blanc. This is the top of the range. We also have handpieces and contra angles for surgery. We have another range of contra angles for implantology, which is, let's say, middle range, impulsion. We have a torque control, which helps you tighten the prosthetic parts into the implant with high security and with the proper torque value. And that's it for the devices around the implantology. Now I will quickly go through the training center. So as I mentioned, it's based in our headquarters in Salanches, in the Alps, but we also offer training all around France and also internationally. This center works with 40 different experts, like Dr. Chomanet, for example, that are dedicated to implantology. And we have an international training program for those users who are not based in France. Still, we organize trainings regularly all along the year to help with the knowledge of our products, but also different procedures. Finally, I want to talk about one of the other focus of the company, which is the manufacturing, which means we manufacture products for other companies and other activities. Basically, it is mainly for medical products, in this case orthopedics or rashi. But we also work for the aeronautic industry or the watch industry. We have the capacity to deliver pieces to those industry. So these basically give us benefits in terms of requirements, in terms of quality. You know that if you work with Airbus, they will require very high standards of quality for your products. We need to be FDA compliant, and it also requires equipment and methods with very high accuracy and competitiveness. I think I'm done now. I just want to show you our new logo. Since a few weeks ago, our company decided to change our logo, so we will need to adapt to this now. And that's it. I hope you have a better understanding of who is Anthogyr, and I thank you again.
Thank you very much, everyone. Now I invite Professor Gilles Chomanet, who is our star speaker today.
So, good evening to all. First of all, thank you very much for having me here tonight. And this is my first time in Saudi Arabia. And even I've been traveling in a lot of those close countries in the Middle East, and particularly in Lebanon, where I did some lecture these last years. But I should say that in this country, this is a very friendly country. And all the people I've met here they all smile. So this is a very nice country. And my first impact is very, very wholesome. So thank you very much. So tonight we will talk about implantology, and through this lecture I want to give you another view of implantology. Of course, we know that we are good implantologists because we have the knowledges. We have this famous evidence-based medicine or dentistry, which is indispensable. But at the same time, we need experience. And if you've seen in these last 30 years, which is actually the number of years I'm placing implants, implantology has changed a lot. And I do think that in the next future, it will change a lot as well. There's a lot to discover. We want better implants, better products, better protocols, and of course, there's not only one procedure. There's as many procedures as you are in this audience. So, I want to give you tonight a new way of thinking, showing you that maybe we have to stay a little bit off the track. I'm talking about conventional implantology. At the same time, I know that because I've been talking with some of you, and tonight in this audience, there's a lot of academic people, a lot of professors, but as well as practitioners that are working in their own clinics. So, like we were talking just before with Dr. Otman Wali, I think that we as implantologists, we have to keep an eye, both on one eye on evidence-based medicine or dentistry, but the other one on clinical outcomes. And this means experience. And I don't think that only one eye can have the truth. Of course, we know that evidence-based dentistry or medicine is fundamental. But honestly, if we all here were waiting just for evidence-based, so there's no way of placing implants. So we will have to wait 10, 20, 30 years to place an implant. So, yeah, okay. I want to present myself. And this is the place where I'm working. I'm initially from Brittany, west part of France. And I've been working in 15 different countries. And these last years, I'm just working in France, in Nice, and in Verona, in Italy. I'm placing, and these are some views of my clinic in Nice, and I'm placing implants since more than 30 years. And I've been placing a lot of different implants. And because of meeting some different people, maybe some of you will change their mind, not completely, not radically, but this will open maybe some doors or windows